Welcome, everyone. I'm your moderator and one of today's presenters. My name is Floris Wardenaar. I'm an associate professor at the College of Health Solutions at Arizona State University. My work has included investigating hydration self-assessment in active populations, the assessment of athletes' dietary intake, athletes' sports nutrition knowledge, and the prevalence of gastrointestinal complaints in athletic populations. I have a keen interest in using simple sensors and measurements as part of field testing, and I currently serve as the current PINES president, a global organization for professionals in nutrition for exercise and sport. I'd like to thank you for joining our Health Talks webinar brought to you by the College of Health Solutions at Arizona State University. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These talks are one way we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. Before we begin, we have a few quick housekeeping items. First, the session is recorded and will be posted on our website, asuhealthtalks.com. After the main presentation, we will have 15 to 20 minutes for Q&A. And please submit your questions using the Zoom's Q&A feature, not the chat box, please. Regardless of whether or not you have requested CEUs, please register your attendance today using the self-check-in link posted in the chat so we have an accurate record of who attended today's webinar. Finally, those of you attending live will receive a brief summary or survey asking you for input about today's webinar. If you are requesting continuing education credits, this must be completed in order to receive the credit. If you did not apply for CEUs, we still would appreciate your feedback to improve our series. I'm so excited to introduce today's first speaker, Dr. David Hondula. David's research focuses on the social and health effects of natural and technological hazards, with an emphasis on extreme heat and power failures. He works closely with local, regional, and state authorities on the development and implementation of plans and programs to make communities safer and more resilient to extreme events. At ASU, David serves on leadership teams for the Urban Climate Research Center and Central Arizona Phoenix Long-Term Ecological Research Program. He's also on the steering committee for the Arizona Extreme Heat Preparedness and Resilience Work Group and faculty affiliate of the Maricopa County Department of Public Health. We are really fortunate to have David with us today as we explore surviving the heat science, hydration, and smart strategies. As temperatures continue to rise, understanding how to stay healthy in extreme heat has never been more important. Today's health talks will provide community-level and research-based perspective on heat preparedness. We'll discuss how the city of Phoenix is responding to increasing heat challenges through planning, programs, and public health efforts, and get individualized strategies for staying safe. David, the floor is yours.
Thanks so much, Floris, and thanks to the organizers for the chance to be here. I'll put the slides on in just a moment. First I want to remind everyone that Floris and I will both speak a little bit today, and the content that Floris will present really can help you as you go through your daily life, stay safe, and your friends and neighbors. So be sure to stick around for Floris's part, because I think I'll have the most immediately actionable information for you. I'm pleased to share an update on what the city of Phoenix is doing as a public health strategy to address the risks associated with extreme heat, and coming from the Office of Heat Response and Mitigation at the city of Phoenix. We will turn on the slides. And Floris, maybe I could just see a thumbs up from you that we are successfully sharing. Thank you. All right, brilliant. So excited to share an update on the city's efforts at a really important and dynamic time in our national conversation on heat. Some of you may have seen an announcement that the Federation of American Scientists just released a new heat policy agenda within the past 48 hours. There is a lot happening from a legislative perspective at all levels of government. We are seeing cities implement new plans, implement new staff positions, develop new budgets around responding to heat. And Phoenix, of course, is a part of that conversation. We are trying to do as best as we can to learn from others and also share what our experiences have been. Today, we're going to talk about the portion of our work on heat that we call the heat response plan. These are the programs and strategies intended to keep people safe during the summer. So today, although I know many out there would love to talk about tree planting and reflective surfaces, building design, et cetera, today we're not going to focus on those topics and instead more of the immediate response strategies, which are implemented with many community partners. A few are represented on the slide here. We appreciate their partnership, in some cases, their funding, their staffing, certainly their expertise. And many city departments as well are involved in this effort. In fact, it is a hard exercise to find a city department that does not have a role to play in the city's heat response program. There are certainly the forward-facing departments like the fire department, like Homeless Solutions, who are very visibly integral to what we're doing. But the behind the scenes process departments are so important as well: budget, finance, law. And we have been seeing great progress over the past few years in raising the level of engagement across those departments and more. The city of Phoenix, maybe the high level takeaway for today is that the city of Phoenix has a heat response plan, as we have now for 4 seasons since the city created an office focused on heat in 2021. And the plan has evolved a bit over the 4 years, but it houses all of the actions that are oriented to keep people safe during the summer, to prevent heat-related illnesses and heat-related deaths. And you're welcome to see the plan online at phoenix.gov/heat. And if you can't find it there, please send an email. The plan addresses 6 strategic priority areas that are shown on the slide here, and which within each of these priority areas are several specific actions. And we won't have time today to go through all of the actions, but you can see what the strategies are. Everything from the work of our paramedics in the field who are deploying an innovative cold water immersion therapy technique for heat stroke patients that we know is having unbelievably transformative outcomes, to the work of our social service first responders as well. They're an integral part of the plan. To, for example, the city's policies that are related to worker safety, a diverse range of approximately 20 actions in the plan. And as you have questions and ideas about them, please do add them to the Q&A. Please email us afterwards. This is a document that's updated on an annual basis, and we need your ideas to make it better. Just to give a few more specific examples of actions in the plan, some of which may be familiar to this audience, some maybe not. In Central Arizona, there is a network of now more than 100 organizations that work together to provide publicly accessible cold space and drinking water through what's known as the Regional Heat Relief Network. And the city of Phoenix is an important part of that network. We offer cooling centers and hydration stations at more than 60 public facilities, and we'll get into more detail about a couple of those. But for example, all City of Phoenix library locations are public cooling centers during their operating hours. We also know that the city's the city facilities only go so far in providing heat relief to the community. Our buildings are where they are, and not every member of the community is inclined to come to a municipal location for heat relief. So we have great respect and appreciation and admiration for the work of other partners in the community that operate heat relief locations. And we've been trying to do what we can as a city to support them, whether it's through direct financial assistance in the past, or this year we're distributing physical goods to those locations to offset some of the costs and challenges that they might have for participating. The city, for those who are renters in the city of Phoenix and not aware, the city has a cooling ordinance that can help protect you If you think your rental unit is too hot in the summer, please do contact the city of Phoenix. The city can take action to bring the landlord into compliance. And specifically for homes that have central air conditioning, the threshold temperature is 82 degrees Fahrenheit. Again, that applies to rental properties with cooling systems. And last but not least, to tie into, I think what we're going to hear a little bit from Floris later on. We've got teams out at some of our busy trailheads throughout the heat season, especially at Camelback and Paestua and select locations at South Mountain, who do some proactive education on busy weekend mornings with the hopes of preventing some of those really challenging technical mountain rescues that we see about on the news. They're providing water, other basic supplies, but hopefully educating the hiking public of how they can stay safe on our very popular trails. I will say, if you do happen to encounter the volunteer who's on the right-hand side of that image from our community emergency response team, and you are in flip-flops with no water, she is almost certainly going to give you a hard time when you're out there. I thought it would be instructive for this audience to get into the weeds a little bit of how we adapt and evolve the plan from one year to the next. And I wanted to share some of the changes that we are making to the heat response plan into 2026, and a little bit of the why behind those changes to show that this is an adaptive, evolving process, and that your input and feedback can really make a difference. This year, we proposed and had approved by the City Council four notable updates to the plan that you can see on the slide here, and we'll go through each of these one by one. The first pertains to our extended hour and 24/7 heat relief locations. 3 to 4 years ago, the conversation really hit a boiling point, recognizing that this regional heat relief network I described has certain deficiencies. I mean, it has many strengths, and one strength is it is an opt-in model that allows broad participation, but it's not a network that's necessarily optimized to solve the problem of heat illnesses and heat deaths. And one of the ways that it is clearly not optimized is that the operating hours for most locations in the network are coupled to standard business hours. And as anyone in the audience knows who has spent a day in Phoenix in the summer, at the end of traditional business hours, it is still dangerously hot outside. So the city took action a few years ago to extend operating hours at a few of our locations and operate a 24/7 location. What that looked like last year was running one 24/7 heat relief location at 20 West Jackson Street here in downtown, just a stone's throw to the southwest of where the Diamondbacks play and where the Suns play. We also offered extended operating hours at 3 library locations. And this investment was very impactful. Across those 4 locations, during the extended hour and 24/7 time periods, there were over 30,000 visits recorded during the summer from more than 5,600 unduplicated people. Uh, I mean, clearly, being inside with access to cold water and air conditioning is safer than many of the alternatives. So there's certainly comfort, safety, and relief offered there. But also some really big wins for long-term heat resilience. 751 placements into housing, shelter, treatment, family reunification, and so forth from conversations that started at a heat relief site last year. It is no exaggeration to say, as we're having this conversation right now, there are dozens of people who are in housing, in shelter, because of work that originated at these heat relief sites. And we know that makes a big difference over the long term in reducing heat-related illness and other risks. We are always learning and adapting these programs to try to do even better, and we have made some changes this year. We are continuing to operate that 24/7 site at 20 West Jackson. But as we looked at where visits were occurring and where the investment available, where the resource available could be best served, we've changed the extended hour model from the library locations this year. We are still operating extended hour program at Choya Library up I-17 at Metro Center. But instead of those two other library locations remaining open with the associated cost, labor, etc., now we're offering extended hours at the Justice Center, also downtown, just a little bit to the west here on Jefferson Street. The Justice Center is an amazing facility. It's a day center for seniors experiencing homelessness from roughly nine to 2. And then in the afternoon, in partnership with the city, becomes fully available to the community heat relief location. We also, I think it's fair to say we were a bit surprised last year with the demand we had from families seeking heat relief at the 20 West Jackson location. Here you see a picture of the dedicated space that was available for families at that location last year, but that space was not sufficient to meet the demand that we saw, and we are incredibly grateful for our partnership with UMOM to provide dedicated relief for families this year. And the city's community assistance program is helping provide transportation. So if a family comes to 20 West Jackson and they're seeking something a little bit more permanent in terms of shelter and other resources, CAP will help move them between the two. I don't have the number as of today, but as a couple days ago, just this season, already 75 families served through this partnership this year. The second notable change to the heat response plan is that we're really leaning into this idea of employee training. The city has a grant from the Federal Emergency Management Agency to work on employee training related to our heat response program. Across the more than 60 very diverse City of Phoenix sites that participate in the heat relief network is an equally or wider range of employees. Everything from 45-year seasoned city leaders to part-time college students who have a summer job. And they are all, whether they knew it or not when they joined the City of Phoenix workforce to work at these locations, they are all on the front lines of the heat response challenge. So we want to be sure there is a high baseline level of knowledge amongst all of those employees that, for example, they are at a heat relief site and what the heat relief network is, to more specific details about what their roles, responsibilities, and obligations are as comes to heat relief. If, for example, you're working at a city pool for your summer job and somebody comes in who collapses from heat exhaustion, or maybe they collapse from heat exhaustion in the parking lot, what exactly is your expectation as a pool attendant, let's say? Those are important questions that we need to be sure that the employees are comfortable with the answer to, so we can be as effective as possible in addressing this really large public health challenge. This is a program that is first focusing on the city workforce, which is in and of itself a complex and large system to deal with. But we are certainly in conversation with some of our partners at ASU, ASU Health, County Health Department, State and beyond, thinking about as we develop training content, how can it be evergreen? How can it be adaptable for other partners in heat relief efforts? Number three, I alluded to this before, the heat relief supply program. Wanted to just give a shout out here to All Thrive 365 in the community, formerly known as FSL, Foundation for Senior Living. They are partnering with the city this year to help get these physical goods out to heat relief sites that are not City of Phoenix locations. You can see some of the supplies here. You can see one of our amazing partners in the heat relief network picking up their supplies. What's what's not shown on the slide here, but is very exciting and encouraging. This is a program that was, I would say, band-aided together for several years with different pockets of money coming together. And over the past 2 years, the city leadership and the city manager have formalized and made permanent the budget to do this as part of the city's overall heat response plan, which has really given us a stronger foundation to build contracts, formal requests for proposal, to make this a mainstream program and make it even more impactful. And last but not least, wanted to thank the Red Cross for their partnership. The Red Cross has really leaned into heat work in the past couple of years, talking about large organizations evolving. The Red Cross here in Arizona, absolutely among them. And the Red Cross is very familiar with the work that has come from ASU and other partners about the unique risks and challenges that mobile and manufactured home residents face when it comes to heat-related illness. Maybe we'll have some discussion about that in the Q&A. But the Red Cross has been trying to do what they can with nursing students, with city partners, with other organizations to ensure that residents of these communities are as aware as possible of the resources out there that may be able to help them. This is work that they've been doing not just in the city of Phoenix, but throughout the Maricopa County area in general. And, certainly thousands of engagements and some really good outcomes from that as well. And yeah, I had the chance to be out with them earlier this year with one of the Phoenix City Council members, and just really appreciate the tone, culture they have around their work here. As please keep your eyes open for opportunities to engage with them in the future if you are interested. As we prepare to hand off, just a couple of other notes here. We are really trying to build a culture for the heat response program at the city that is intelligence driven. So we're collecting the visitation data that you heard about before. We're looking at heat related illness data on a regular basis to understand if there are any unusual patterns that are playing out. We provide weekly reports to the city leadership team, to city council, and the public at phoenix.gov/heat, and are always working to improve the dialogue between those many departments that I talked about before that have a role to play. If somebody shows up at a heat relief site because their rental property is too hot, we need everybody involved to know that there's a cooling ordinance involved, how we can make that conversation into the department that manages that, how we can follow through on those conversations. And I think we're seeing real progress there. And we're seeing real progress in outcomes. And I'm absolutely not here to say that the city of Phoenix is solely or maybe even partially responsible for the pattern we've seen in the past couple of years. But there is good news in our region that the decade plus trend of increasing heat related deaths has now moved in the other direction 2 years in a row, including an approximate 30% reduction from 2024 to 2025. I mean, for those of you who are racking your brain for thesis or dissertation topics or papers to write, I would argue the why behind this pattern is mostly unknown. And there are some good hypotheses to be formed out there. And there have been some real changes in the public health response to heat in our region over the past couple of years. The 24/7 and extended hour locations that I mentioned, the work that the fire department is doing with cold water immersion. That seems to be having really transformative outcomes in medical settings. But I think there are macro factors as well to think about as related to homelessness, substance use, housing, and of course the weather has a role here. We absolutely got a bit of a break in the weather in 2025 compared to 2023 and 2024, but 2025 was still amongst the top 5 hottest summers in Phoenix's history. So how do we understand how these micro and macro pieces are moving together to produce this pattern? We have a lot to learn there, and I think we need to learn it as quickly as possible to know where our investments should be guided next. And I look forward to engaging with all of you on that work. Thank you again for the opportunity to present. And I always love hearing from Floris about the amazing science that he is advancing as related to the body's performance in heat. So Floris, welcome back to the stage, and eager to hear from you. Thank you.
Thanks, David. Before I continue today's talk, I'd like to remind you all on the other side of the room, if you haven't already done so, please register for your attendance. So use the self-check-in link posted in the chat so we have an accurate record of who attended today's webinar. So the next thing that I will do is start sharing my slides. And then, David, it would help me if you give me that same thumbs up as well, if to see if everything goes as planned. Okay, good.
Perfect.
So it's my job now to sort of um, talk with you a little bit about what you can do on an individual level based on some of the research that we have been doing in the valley, most of it. So I will talk about heat impacting activity and hydration status. So an important thing is that if you are active in that extreme heat that we have here in the valley, then exertional heat illness is a serious risk. And heat exhaustion can already occur just slightly above baseline normal temperature level, as you can see, the 99 degrees Fahrenheit. If people have a body core temperature that is exceeding 104 degrees Fahrenheit, then we could say that we're actually having a heat stroke. So there's different symptoms that you can track when people are heat exhausted, and some of them are similar to what we see in heat stroke. But specifically for heat stroke, what is different is that we often don't see any sweating anymore, that there is a red, hot, and dry skin, and that there is a very rapid and strong pulse in most of the cases. So that's a way that symptom-wise you can already try to distinguish both. Um, this happens obviously when people can be active, but in some situations it may just be with people that are outside for too long. So factors that influence that body core temperature are your fitness level. So how fit are you? Are you adapted to the heat? If you're always inside in the AC and then at some point you decide to go outside in today's weather, then you will not be adapted to the heat yet. What kind of cooling options do you have? And fluid intake in itself is an important way to maintain the cooling capacity of the body, specifically when it is so hot that the environment is warmer than the body, the skin temperature itself. Then the only way for the body to cool is to evaporate sweat. One of the good things is that because it's relatively dry in this area, you can be very effective in sweating. On the other hand, often we don't really recognize that we're sweating because the sweat is evaporating so fast that you don't get that response from your body and thinking, oh yeah, I need to drink more. So I like to study athletes, but at the same time, I'm interested in active populations. And we know that athletes are normally fit, they're well acclimated, have cooling options, and they're trained to compensate fluid loss. But hikers and other recreationally active people may not be fit nor acclimated. They lack effective cooling opportunities when they're out, and often they're not trained to drink. So that means that the general population is sort of lacking behind when going outside. And that means that I think being active as a population is important as well. And then probably year round, and then being mindful active when it's very, very hot. So David has been showing some data about the amount of deaths in the valley. Um, and another way to look at the impact of heat is, for example, to look at hiker rescues. And for years, we already see that more than 250 hikers need to be rescued in the Phoenix area per year. So that's an interesting metric to follow in the coming years to see if we can also make progress over there. So one of the studies that we did and that we published quite recently was based on an exit questionnaire that we did at Piestewa Peak Trail Summit. And as you can see, if you rank the risk perceptions that we questioned, the Phoenix heat in itself is seen as an important risk factor. So people are quite aware that it's hot, and therefore they often take different strategies. So, for example, in this case, a lot of the people that we questioned actually went up the Piestewa Peak even before it started to become light. And then they came down when there was light, but they were sort of selecting the coolest moment during the day. So temperature is important, and it is also something to keep in mind that what we have on our phones, our weather apps, they are often based on our metric stations, meteorological stations that we have in the area. And what we did was a comparison over the last couple of years between different surfaces and measuring on the surface versus the numbers that we generated from those stations. And as you can see, there is a disconnect between what the stations report, so what probably is visible in your phone app, versus what on the ground is the actual temperature. And you can see, regardless of the surface in this specific area, so if it is clay or grass or a tennis court, it didn't really differ too much. But we saw a huge difference, for example, between June, when it was relatively dry still in the valley, and in August, when a monsoon hits and it's more humid. So the interesting thing here is that there's some letters, the C, the L, and the D, and they suggest, based on the metrics, that you need to be, when you sort of cross this line, the D, that you need to be discreet about what are you doing. So looking at this, the L is a limit activity, and then C is cancel activity. So in June, and I think in July, we're sort of just in between June and August, you can see that you can do most activities during the day with discretion. But at the same time, if you want to have the lowest amount of heat stress, then probably it's best to do it at the start of the day. At the end of the day, you see that temperatures are lower than in the middle of the day, but they're still a little bit higher than what you see in the morning. And that's also because our environment is absorbing the heat in the surface, right? So if you are outside and you are in a rocky environment, then in the evening, even though there is no sun exposure anymore, maybe you are behind you're in the shade, then still it can be warmer just because it warmed up during the day. As you can see in August, when it's getting more humid and we're getting there, then you need to be way more discreet when you exercise. And then in that case, it would be way better not to go exercise in the middle of the day, because you can see that we are getting into that range of cancellations, specifically when you measure it on the ground. So be mindful that the app that you use is probably underestimating the heat. By the way, I put those QR codes on the lower level of the slide, so that you can actually find those studies if you're interested in it. So one of the things that we did also, I think it was last year, what was the year before? Last year. We wanted to know, how long do you need to stay inside, for example, in a cooling center, before your body temperature goes down and you can safely return to the outside. And we partnered with the Justice Center. By the way, both of the studies that I show here and the one previous, I was participating with Dr. Jenny Van Os, who was leading those studies. So we partnered with Justice Center, a homeless shelter, and those people that we included were at least 4 to 5 hours on the street before they came in. Some of them were the majority of the day outside. Some of them slept outside. But you can see that in general, people take around 60 minutes in that environment of the Justice Center. That was not even that cool, right? To get their core temperature down. So based on that, we could say probably if you are hot and you need to cool off, take at least 60 minutes to go down in a cool environment. And then you get back to sort of your baseline core temperature level. Um, this study obviously is not giving any insights in how fast core temperature will go up and how fast, the question is how well is your body able to bounce back of, repeated heat exposure. But this is a first study just to give a better insight in how long do you need to stay inside. One of the things that you could potentially do, and specifically athletes are good at that, is trying to cool in addition. And as you can see here, this is a picture that was just taken at the first day of the Tour de France. It started 6 days ago with the time trial, and you see that all those team members of this specific team, they are cooling their underarms or their forearms in cold water, and they have ice vests on. Um, and I think outside probably that will be a good solution to lower their core body temperature before they need to do the exercise that they are planning to do. Just to make sure that while they start, that they have the biggest advantage, and that they can reach the highest core temperature possible within the time that they need to do their exercise. What we did in a study is we heated people up to 38 degrees Celsius and a little bit above. And then we cooled them down in several ways. Also similar to what you see here. That was the combination. And what we found was that the cool vest itself was most impactful, although there was a big range, but there was not really a big difference between the interventions that we had and the control. And I think the difference from the picture is that those people were outside. So we're trying to maintain being cool while being outside, while we brought our people in our lab that was cooled by air conditioning. So then we actually go back to the previous example. If you bring people in, very likely that you can already have them cool off just by being in an air-conditioned room. Um, the numbers that you see here, the cooling rate is really comparable to what you see in the literature with this type of interventions. So it seems that the being inside has the largest impact, even if it is only 24 degrees Celsius. So that is sort of normal 72, 73 Fahrenheit room temperature as we see here in the valley often. So this is the other part of the study. Actually went before it because what I wanted to know is if you can use exercise in combination with passive heating to keep your core temperature elevated. And why is that interesting? Because if you do something like that, then you can exercise, stay outside in the heat for a little bit, specifically here, keep your core temperature high, and that will help you to adapt to the heat at the start of the season, so in spring. But the other part probably is true as well. So if we now go outside and we exercise and we increase our core temperature, then we might actually need to go inside directly afterwards to make sure that we cool down, because otherwise you keep that elevated core temperature for a longer time. And specifically in the hot conditions that we have here, that's probably not a positive. So you can use this knowledge depending on the time where you are in season to sort of tailor how you want to dealing with the heat, but also how you want to manage recovery. So I think when you start season in spring, it could be a strategy to actually stay outside and you will adapt quicker to the warm environment. That same knowledge will help to keep us safe. If you exercise now, make sure that you go into a cooler environment afterwards just to stay safe. So finally, one of the things that we need to do is make sure that we optimally hydrate. This is a simple example. You have a sponge. If the sponge is really well hydrated, you can see that it's completely inflated. Um, if you are suboptimally hydrated, the sponge is still wet, but it's just not keeping that much fluid, right? So we know that optimal fluid intake has been associated with better cognition, better mood and fatigue, and potentially with improvements for physical performance, while chronically low intake actually has all negative impacts on the long term. And then further, we would think that if you start in a well-hydrated situation and you come in the dehydrated state, where you lose actively fluid, for example, through exercise, that it is better to start coming from the euhydrated state than from the underhydrated state, because you just have more fluid in your body to lose through exercise to cool your body, through the process of dehydration. So a good way to sort of monitor if you're drinking enough is just to count how much you drink. There is a good example done by Dr. Stavros Skoufouros's team. If you meet the fluid recommendation as set by the IOM, then it's very likely that you will keep a low urine concentration over 24-hour period, and therefore you will maintain that good hydration. Another thing that you can do is, for example, look at the color of your urine, and we're specifically then looking for that light urine color. As you can see here, there is a difference in the volume that you assess. We normally use those small tubes to look at it, but that means that if you have a cup and you use it, then always use the same cup, because the difference between the volume can already indicate a difference of a one shade color. On the right side, you can see how accurate we can actually assess through urine color the urine concentration, if it is high or low. And in this case, we were looking in this study for a low urine concentration below 1.0112 urine specific gravity, so the amount of particles in the urine. And you can see that a spot sample itself doesn't predict 24-hour urine concentration in a very good way, but it does predict pretty well the sample itself. And you can see that an afternoon sample taken in the afternoon is actually doing better job, more accurate. I had a student, Zach Stowe, that actually combined the morning and the afternoon sample and then found an even better accuracy, up to 95%, meaning that if you are able to measure or look at it multiple times during the day, and every time during the day you will find a bright light color, it's very likely that you're well hydrated. So that's something to keep in mind. So I'll finish up with some tips and then we can go to the Q&A. Work on your fitness year round, but be careful high summer. So if you like to exercise, go early morning, for example, or exercise inside when it's really hot. You can also exercise when the sun is going down, but be mindful that it will still be very warm. Combine activity with shade, cool if you can. Go inside to AC cooled room after exercise to cool down quickly. And bring enough fluid and be mindful to hydrate during the day. And that's something that you can practice. And try to meet fluid recommendations. Check the color of your urine. So I think that's what I had to share. I'm gonna go back to my script, and then we end up into the Q&A. Let's see. Yeah, I actually need to go to the Q&A from here. So let's see what we have for questions. So the first question, it's a long one. So let me bear with me. Thank you for the insightful discussion. We know that certain groups, such as older adults, people living with obesity, diabetes, cardiovascular, or kidney disease, and those with impaired hydration, are at much greater risk during extreme heat. While physically active individuals often have better heat tolerance due to regular training and healthier lifestyles, many people do not have the same physiological resilience. So my question is, based on current scientific evidence, what are the most effective long-term lifestyle interventions that individuals can adopt throughout life to improve heat resilience? Beyond hydration, which factors such as physical fitness, nutrition, body composition, or metabolic health play the greatest role in preparing the body to better tolerate increasingly frequent heat waves? So that's a long question, and it is a complex question. Um, I wonder, David, do you have any idea from the perspective of the city, what the city has been doing to ensure that people can be fit while living in Phoenix?
Yeah, thanks, Floris. I'm sure you have a lot to say on this one as well. Uh, I do think knowledge about available resources might also be part of an answer to this question. But the question really, and the way Flores framed it, really makes me think about what cities and developers can do to facilitate physical activity, even through the summer. And this makes me think about urban greening initiatives, having shade where we need it at playgrounds, on walking paths, etc. Floris, I think it would be fair to say that while it might not be the same as sprinting up Paestua on a hot day, a 20-minute walk in the heat is part of an acclimatization program and can help us maintain a level of fitness and help ward off some chronic diseases. And I would. I think I operate under the premise that anything we can do to facilitate a more active society is good for our overall heat resilience. Yeah, just and what the city can do to promote that, I think is part of the story. What do you think?
Yeah, obviously, I think we can all acknowledge that we have extreme heat in this area. So that is limiting the amount of activity that some people can do, specifically when it is that hot outside. So it asks for flexibility from us, from the people that live in this area, to sort of figure out what you can do within reasonable limits. I think it's different from example, other cities that now have been exposed to heat waves that sort of come unexpected. We know that the heat is coming. When I was hired 9 years ago at ASU, they told me, it's bad for 3 months, but after that, the rest of the year, it's great. Um, I know now that it is not 3 months, but it is already 4 or 4.5 months that it's really hot. But that's something that we can prepare for. So one of the things that I definitely think that we can do is that we can use the heat and the warming up early in the year already to be part of our training program. So it's not only doing exercises outside, but maybe specifically in spring, if you have been doing some activity, even if it was inside, maybe sit outside in the backyard, on the porch, or sit outside somewhere where you can be exposed to the warmth. Hydrate yourself and get some outdoor exposure. That definitely may help just to be more ready when the real heat comes. I think that's definitely a strategy that people can keep in mind. The other thing is to be aware about, okay, what can you do fluid-wise and diet-wise to support exercise throughout the year. One of the things that we've seen is that when it starts to get warm, hikers tend to drink or they tend to bring more fluid to a trail than at the end of the hiking season. And we don't really know why, but I think it is because at first they sort of are worried because they come from winter and they think, oh, it's warm. And then throughout the summer, they sort of experience how much they sort of need. And then when, the end of the hiking season, or let's see, say it's not the end of the hiking season, but if you get towards September, October, then people just bring less water because they know that they can deal with it with a little bit less. At the same time, people still lose a substantial amount of fluid. So I think we need to educate people about how much they need to drink and need to be make them aware about how much fluid they lose. And specifically, when you get adapted better to the heat, you will lose more fluid through sweat. So you need to drink more as well. So it's a very complex question, and I'm not sure if we have been able to answer it fully. But I think it comes down to, engaging with uh, individuals and try to find a way that works for them. And if people are really compromised with their health, then obviously they should be very careful to go into the summer heat too long. So it's finding sort of that niche where they can operate in a good way. And that could be that for them, exercising inside is then a better way to maintain their fitness, so that the outside time that they can use it just for their transport mode, right? To go and have a social life so that they can be outside and maintain good health.
Floris, I'll be happy to throw you the next question in the chat from Aina. Thank you. Um, Noted that you mentioned going to a cool room. Uh, that is a helpful strategy, I think, for recovery. You mentioned. What defines a cool room, and what do you do if that is not an option? Was the first
Yeah.
part of the question.
Yeah, so I think here in the valley, I think that a cool room probably is somewhere between 70 and 78 degrees Fahrenheit. So that is what we sort of see as a cool room. Preferably there is AC. Um, if that is not an option, then I think if you have access to a pool, hop in the pool and cool off. That's not the coldest water, but it will definitely cool you down. There is some research, and I think David, you know better about that. If it's really dry, at some point, fanning itself doesn't help, right? It's better to make sure that you are wet and maybe then generate some air flotation around the body.
And then the second part of Aina's question is, what is the next best alternative when water is not abundant? Although maybe that was related to the cooling question.
Yeah, yeah,
So yeah.
this is a great question that you could ask kids, when they, in survival mode. What if you're in the Grand Canyon and you only have 4 bottles of water? Are you going to use it to cool your body, or are you going to use it to drink? Probably in that situation, you're going to use it to be able to drink, because there's a mental component there as well, that it just helps to sometimes have some water. Uh, but if you are in a situation where you know that you will be back in a car, or you have more water in the car and you're back in 20 minutes over there, then you can decide to maybe just pour the water over yourself and make sure that you keep moving, or at least get into some of the air. What is it? So that you have some wind exposure, that at least there's airflow. I think that's probably what at that time is the best option. Medically, you get into cooling with ice baths and so on, and that's something what, for example, the Phoenix Fire is using, right? They have those big cool bags. They dump ice in it when someone is really heat exhausted, and they cool down the body very fast before they bring them to the ER.
Well, let's try one more before the clock strikes 1 o'clock here. I think this will also be a good one for you, Floris, from Joanne. Thank you for the question. Can food be substituted for liquid to reach fluid intake requirements?
Yeah, so how fluid requirements are set in the United States, but many Western countries, is that roughly 20% of the fluid requirement comes from solid foods. So that's just something how it is calculated. So normally you will get it from semi-solids, most like yogurt and maybe applesauce, that kind of things. So yeah, it adds to it.
Great. Well, Floris, it's 12:58, which I know there are a few more questions in the chat that perhaps we can follow up with after the webinar. But I believe you may have some inspirational closing words for us.
Yeah, yeah. So um, it's true. It's all the time we have for today. So I apologize that we were not able to answer all the questions. If you have not already done so, please register your attendance using the self-check-in link posted in the chat, so we have an accurate record of who attended today's webinar. We encourage you to follow the College of Health Solutions on social media, where you learn about other opportunities like this one. Our Health Talk series will continue in September. Details and registration will be becoming available at ASUhealthtalks.com. Thank you again and have a great rest of your day.